Okay, so let's dive in. We're looking at a specific remedy today, right? From an older text.
That's right. It's excerpts from Boericke's Materia Medica. The text is Anisum Stellatum Homeopathic Materia Medica.
Anisum stellatum. That's star anise, yeah.
Yeah, exactly, star anise, or sometimes called Elysium. And, well, the goal here is really to pull out what Boericke highlights, the most specific or maybe even surprising symptom connections he makes.
Right. Give you a real sense of what stood out to him.
Mm-hmm.
Okay, so starting point. Where does Boericke place this remedy first? Like its main thing?
Well, he kicks off with flatulent conditions. That's the sort of the headline use he mentions first.
Flatulence. Okay. And he gets more specific though, doesn't he? Something about 3 months colic.
Yeah, he does. And the interesting bit is he notes it's especially relevant if it recurs at regular hours.
Ah, that timing thing. Regular hours.
Exactly, that specific timing detail. Plus, he mentions much rumbling in the abdomen.
Okay, so that regularity is a key marker. But then there's this symptom he really flags, right? Calls it worthy of special remembrance. This gets really specific.
It does, and this is where it gets quite fascinating. The anatomical precision. He talks about pain in the region of the third rib.
The third rib. Wow, not just chest pain.
Exactly, the third one. And he even nails it down further. About an inch or two from the sternum.
An inch or two from the sternum. That's incredibly precise.
Mm-hmm. And usually on the right side, he says, but occasionally on the left. That kind of detail, specific rib, distant side. It's pretty striking for a plant remedy description.
And is that rib pain like just on its own or a link to other things in the description?
No, he connects it. He mentions a frequent cough with this pain. So it's tied into breathing, seems like.
Okay, a cough specifically with that pain. What else on the respiratory front? He seems to cover quite a bit there.
He does, yeah. He talks about purulent tracheal and gastric catarrh of old drunkards. That's, inflammation was discharged.
Catarrh, right.
Also mentions it being relevant for old asthmatics, dyspnea, which is just difficulty breathing.
Mm-hmm.
And he repeats the pain near third intercostal cartilage, basically hitting that third rib spot again, plus a cough with pus-like phlegm.
So a real cluster around the chest and breathing, and some very specific patient types mentioned too. But then he lists other things that seem, well, quite different from gas or coughs.
Yeah, it broadens out. He includes palpitation with ephthe. Those are like mouth sores or ulcers. And hemoptysis, which is coughing up blood.
Coughing blood, okay. That's serious.
Yeah. And then even things like vomiting and epileptiform convulsions with biting of tongue. So quite a range beyond the initial focus.
Definitely shows the breadth of associations you can find in these kinds of texts. Didn't he also mention some like sensations around the nose and lip? Little details?
He did, yeah. Things like sharp stitches beneath lip, acute catarrh, like a bad head cold maybe,
Yeah.
and this specific burning and numbness of inner lower lip. Very localized sensations.
So much fine detail. And just for context, does he mention how it might be, prepared or used according to the system?
Briefly, yes. He notes the third potency is recommended. That's just a specific level of dilution and preparation in that particular system.
Okay, the third potency. So looking at all this, the colic that comes back at set times, that super specific third rib pain, the cough, the lip numbness. What does pulling this all together tell us, or you listening, about how these texts approached remedy?
Well, I think it really underscores the highly observational aspect of creating these materia medica. It seems like the goal wasn't necessarily a deep theoretical why, but more about meticulously documenting these incredibly precise symptom patterns that observers associated with the substance, anise in this case.
Right. It wasn't about the mechanism, just the pattern.
Exactly. So, for you trying to understand these sources, the idea described here is that matching a remedy like Anisum stellatum would involve finding these very specific, maybe even seemingly quirky characteristics in the person seeking help.
It's all about that precise pattern matching then. Finding those very specific points of connection that Boericke laid out.
That seems to be the approach described in the text, yeah. Finding those exact matches.
Which kind of leaves you wondering, doesn't it? I mean, how does a common spice like star anise come to be associated with such a, unique set of symptoms? Particularly something so weirdly specific as pain near the third rib, an inch or two from the sternum, usually on the right, maybe with a cough, alongside timed colic.
It's a great question. What does that extraordinary specificity imply about the method? The observation and the recording process that went into creating these detailed old texts. Definitely something to mull over.